Luigi, thank you, sir, for joining us. Oh, yeah.
Yeah, okay. Thank you for inviting me. It's always a pleasure.
I will just want to just do a little history. I know you through our mutual friend, Dr. Alfonso Fasano.
Mm-hmm.
I believe you went to medical school with him. Is that right?
Yes, that's correct.
And actually, how I think I friended you first is I saw Alfonso posted something about a TED Talk you did.
Yes.
And I listened to that TED Talk. I said, I've got to friend this guy on Facebook, which led to us communicating. And we met on my birthday in New York City 2 years ago.
Yes.
So
on your 25th birthday, right?
Yeah, my 25th birthday. Yes. My kids are older than me. So, yeah, and you've been doing some really interesting, fascinating work in so many different areas. And I think, I was trying to think last night, I think we've done 4 interviews now on my YouTube channel, right?
Yes, yes.
We did the first one, and then we did...
Yeah, we did one on autism, I think, and 3 on COVID, on different...
Yes, yes. So, I appreciate, again, you joining us because I'm going to make the screen big so you're bigger in a second here. But one of the things we know statistically in the Parkinson's population, we talked about it earlier this morning with our group, is that complications from breathing issues, as Alfonso actually showed me, is the number 2 cause of death or mortality. Complications from a fall is number 1. But sometimes the fall can lead to the breathing issues. For example, Alfonso was showing me a video of a gentleman who fell down. I think his wife recorded it or something, and fell down, got wedged between a rock and a fence. She couldn't get him up. He couldn't get up. He hit his head on something. 911 calls. Ambulance takes him. A month later, he gets pneumonia and he passes away. And so, you know, I have a history of upper respiratory issues as well. I am blood clotting, so I really don't want to get COVID because of the blood clotting issues it can cause, and it doesn't seem like a good thing to have. But you and I have talked now multiple times about COVID, and I'm glad to have you with us. And maybe if you could shed a little light about COVID and any concerns in the Parkinson's population, especially knowing the dopamine pathways are compromised. Sometimes internal, like rigidity of chest musculature restricts expansion of lungs. The floor is yours, my friend. Thank you.
Yes, thank you. So the first thing is that I would like to clarify my background. As you said, I'm an MD by training, and I'm a geneticist. So my major areas of expertise are autism, and related syndromes, cancer pathways, and recently, like many of us, have been kind of redirecting part of my attention to the COVID-19 pandemic, just because it touches so many fields and impacts our society and our healthcare so heavily. And by learning about this pandemic and this virus, it actually came to attention that it touches so many different districts of our body. So obviously the attention is mainly focused on the respiratory complications that, like you mentioned, are also of concern in the world of Parkinson's disease. But there is so much more that can be affected by COVID, and actually our mutual friend Alfonso showed that beautifully in his recent paper, where he highlighted the correlation between advanced or severe manifestations of Parkinson and risk for COVID-19 complications. So basically, in the presence of certain features like dementia that appears in advanced stages of Parkinson, there is a higher chance for complications of COVID. And there are several interpretations of these. The main thing to consider from the molecular and biological standpoint is the fact that the SARS-CoV-2 virus, which is the virus responsible COVID-19 targets the ACE2 receptors, which are receptors that are expressed ubiquitously, which means pretty much in every tissue of the body, but they do have a high level of expression in the brain. So that is very important because it really tells us that we're just starting to understand what are the long-term consequences of an infection by the SARS-CoV-2 virus. That said, the problem with the respiratory issues and the problem with the falls, I think it goes beyond the single injury or the single infection. I'm not a neurologist, so take these, with the proper consideration. But I think that Parkinson disease affects a lot, elder individuals, and staying active, like you, teach very well. It's critical in these individuals, not just for their motor impairment related to Parkinson, but for a series of metabolic benefits that they can get from continuous activity. So infection by COVID or a fall or any other sort of injury or trauma that will limit their mobility, on top of Parkinson, of course, will affect several aspects of their health. Because if we consider a person that is over 70 or over 75, that keeps a mild or moderate level of activity, takes some walks, goes up and down the stairs, does some very, very light exercise, and then we have this person bedridden for weeks. There is an impact in the metabolism. There is an impact in their muscle tone. And like you were saying before, if you start an activity and if you introduce that activity as a routine, like dancing or doing, certain types of exercise, your muscles retain a certain memory of that. So even without involving too much the voluntary stimuli, the muscles are still able to perform that at the acceptable level of quality of performance. So the point is, if you remove that routine, if you remove the constant exercise, on top of the consequences of the COVID-19 infection or the fall per se, that forced inactivity already introduces a dimension of limitation, affection of the metabolism of that individual that will have several consequences. I mean, in the end, most of the activity that you're teaching is focused on burst the metabolism, loses the joints that are, too stiff, train the muscles, all those things are going to be lost if you have a person that either for COVID-19 infection or for a fall is bedridden for weeks. Mm-hmm. Mm-hmm. So this is already something that we need to consider. And once again, it makes us appreciate the impact of regular exercise and the quality of our life, especially, if we grow older. Then, on top of that, if we go specifically into the impact of the fall, we know there is a risk for bone fractures, there is a risk for joint dislocations, these complications. And of course, there is a smaller margin of recovery that will extend the time of recovery and will affect the outcome of the recovery. So in simple words, it takes longer to go back to normal. You might not go back to exactly the normal, the way you were. And, you will not feel right. So that is another factor that eventually will affect the motility, will affect the activity of the individual. And then as a third step, if we go to COVID has been proved that does leave some long-term effects even after the person is clinically considered healed or recovered. There are reports of pulmonary fibrosis, even if limited, and not to the severe extent.
Wow.
Of course, will limit the capacity of the person to play sports or to perform some exercises, because it will limit the capacity of the lungs to fulfill the medical needs. So, of course, it's something that maybe some people that live a sedentary life will never notice because they will never push the activity, to test that their pulmonary reserve.
Sure.
For people that actually engage some activity or they used to before the infection, they will clearly notice the difference.
Mm-hmm.
And then some other traits that persist beyond, the negative test, so beyond the normalization of the title, the antibody title, or the normalization of the antigen level of SARS-CoV-2, is this persistent fatigue. And that is another thing that, of course, will hamper the exercise capacity of a person.
Mm-hmm.
The person will feel tired, will feel like the muscles are aching, or, feels like lost some stamina. So that is very important because, again, as you teach, you want to revive that stamina. You want to really push those people to burst up their metabolism and start engaging a more active lifestyle. So if you do feel that fatigue, which is, let's not forget, a neurological symptom, is not something related to the muscle, it's not psychological, it is an actual neurological symptom, and it might last on long term, it might become chronic. Mm-hmm. All these things do have a critical impact on the life quality of an individual, and they will limit, whatever progress or whatever management that they're doing of their Parkinson's symptoms.
Interesting. So I have read a few articles, one in particular, I don't remember who published it, I just remember who shared it with me, was Dr. John Rady from Harvard. He's also an author, about how exercise can help if somebody, gets COVID, that it can help to, let's say, diminish maybe the symptoms or help recover faster from it. It sounds like you would recommend that as well, right?
Yes, there is of course a threshold. If you have a person that is just coming out of ICU,
sure,
should to run a marathon right away, or
exactly
run a mile. But yes, there is a problem. Like I said, COVID-19 affects several tissues. One of the most insidious threats is the increased tendency to coagulation. So you want to pump more oxygen in your blood. You want to, open up more vessels. You want to have your blood circulating more to prevent that risk. So hydration is a very good thing because it will keep your blood from getting too dense and therefore increase the risk of coagulation. Activity is another good thing, because it will open up more capillary vessels. It will help, the circulation in general, will help the tissues to stay more oxygenized. So this is something, of course, that either has a very abrupt and evident manifestation. You have people that have strokes or have, intrapulmonary coagulation, or, it might be very subtle, and you might, pass your clinical stage of COVID and go through your, coughing and pulmonary problems, and then you go back home and you still have the risk of increasing, coagulation. And that is why it's helpful to keep, your blood circulating, to keep yourself active. It depends, of course, if you are, sustained by a good pulmonary function. Mm-hmm. COVID did not leave that pulmonary fibrosis and have a very bad interstitial pneumonia. If you can afford to do some exercise, then it's good. Okay,
great. And just in case, I just want to make sure, in case anyone knows, needs to know coagulation, we're talking about blood that is more dense that can lead to clotting, correct?
Yes.
I only relate to that these days because of the clots I had last year.
Yeah.
And another reason I don't want to get COVID, but I'm not sure if being on Coumadin will help that or not, but it helps me right now. I seem to be in a very good place.
And if I may, there is another connection between exercise and decreasing risk of COVID. We mentioned the ACE2 receptors. Mm-hmm. ACE2 receptors have been proved they are more expressed in individuals that are obese or in individuals with diabetes, because they are involved with the high blood pressure and hypertension. So taking keeping your body weight under control, preventing the onset of diabetes, that has a huge impact. In fact, as of now, diabetes, a combination of diabetes, hypertension, and obesity seems to be the worst possible scenario in terms of risk for complications of COVID or severe presentation of COVID, even more than previous respiratory conditions.
Interesting. And anyone who knows me knows that 11, 12 years ago, I weighed a lot more than I do now, pushing 275, 280, and I'm 6'2", so I shouldn't be weighing that much. So I can relate with it and hypertension to a very high blood pressure, pre-diabetic. And I'm not saying this to brag, but I was scared and I didn't want to get sick. This is way before COVID, of course. And I didn't want the problems that could go along with those complications. And, I have 2 children. I have a granddaughter on the way now. I'm just glad I'm healthy for many reasons, but one is just I want to be around for a long time to watch this granddaughter grow up, So I'm glad you brought that up, because I've seen in reports and studies how that trifecta there of diabetes, obesity, and high blood pressure can really be the worst possible combination. Can you go back for a minute when you're talking about the receptors? Can you explain just a little bit more about those, what receptors they are, where they are, and just a little bit more about the details on that?
Yes, so basically the ACE2 receptors are very common. Like I said, they're expressed ubiquitously, so everywhere in our body, in every sort of tissue, and they are actually targeted by drugs involved in hypertension.
Okay.
Yeah, and so this is important because at the beginning it was thought that taking certain drugs for high blood pressure could have actually stimulated the overexpression of these receptors and therefore being a risk factor for infection of COVID-19. This has been proved to be not true, or true just in part, because if you do have that hypertension, you still have a risk of having a high level of expression of these receptors. So the drugs may not be the culprit here, but they might be just a secondary factor. So basically, ACE2 stands for angiotensin converting type 2. And angiotensin is, in fact, a protein that is involved in regulating the pressure in the vessels. So by converting angiotensin, modulate the efficacy of this protein, and therefore you modulate also the blood pressure in your vessels. So it works not on your heart, but it works on the circulation peripherically. Mm-hmm. And then that is important. So it is commonly targeted, like I said. So many people are taking ACE2 inhibitors, which is those type of drugs that are used, to keep your blood pressure under control. So it's important to keep in mind that this is just the target of the virus. So it's not like the only thing that we need to keep in mind, because the virus comes in through the mucosa. Has been proved that might enter our body through our respiratory system, through our eyes.
Eyes too, yeah.
Yeah, it is very frequent in our stools, because again, it colonizes the intestine. So even contaminated sources of water, they might be a cause of infection. So there are several things, like I said, that we need to consider. But when we talk about the receptors, they might help us to understand where it's more likely that the SARS-CoV-2 virus may actually produce some deleterious effect. That said, we all know that the first organ in terms of gravity of severity of symptoms is the lungs. So we know that we want to prevent the infection at the respiratory level, and unlike other viruses of the coronavirus family, it looks like the SARS-CoV-2 targets more the lower respiratory trait. So instead of, even if we do test them in the nasopharyngeal mucosa or in the saliva, because like I said, it goes everywhere in the respiratory system. But in terms of damage, while other viruses of this family may cause the common cold, so something that affects more the upper respiratory ways, the SARS-CoV-2 seems to have more deleterious effects on the lower ones. So bronchi, lungs, and so on.
Interesting. So let's take this now, and before I open it up for any questions, if we take all this knowledge now and just put it over into the Parkinson's population, which is already at an increased risk, I think about actually in my book, in chapter 4, Dr. Ingrid Estrada Bellarmine and Dr. Fernando Carrera wrote a piece about breathing issues and Parkinson's, which is pre-COVID. But when we talk about some of the rigidity that can happen, some of the rigidity or internal like tremors too, but more so the rigidity of the chest, and being able to expand the rib cage and the lungs to take a deeper breath. How do you look at it for that population or any population with an increased rate of, let's say, increased respiratory issues or chances of respiratory issues, specifically Parkinson's though? Like, transfer all this knowledge, talk about looking at Parkinson's. What are your main concerns there?
Well, of course, we need to consider what is the scenario. The lower expansion of the thoracic cage that is, caused by the reduced motility of the muscles is usually something that comes later, in the Parkinson set of symptoms. So we're really talking about quite an advanced stage. We know that it's more common to have motility problems affecting the limbs, so the ambulation, other things, or other things that might affect more central symptoms like the loss of smell, which, by the way, is also present in patients with infection of COVID-19.
Yeah, right.
So we are definitely talking about a person that cannot expand his chest enough. It's a person that already has probably an advanced case of Parkinson. It's not really that the presentation is not really coming at the beginning of the onset. So obviously, is a person that is supposed to be monitored, is supposed to have a certain protocol to follow in terms of management and treatment. At the same time, if you do need to expand your chest, so if you have that shortness of breath, obviously we're talking about either a very acute manifestation of COVID, like things are getting bad really fast, or something that has deteriorated with time. So basically the mechanism is that you have this pneumonia. The pneumonia is bringing inflammation to the alveoli, so the very smallest component of the respiratory system, where you have the gas exchange. And instead of having these empty microscopic bags, surrounded by a very thin layer of tissue, where you do have the air, coming in and the oxygen is exchanged, you have a colonization of these alveoli, so these little empty bags, by immune cells, by exudate liquid. So obviously the gas finds more obstacles to filter through all these things, and blood doesn't get enough oxygen. So in order to do that, you feel that you can't breathe well, you can't breathe enough, so you have the shortness of breath. You try to accelerate your pace of breathing and try to expand your chest even more. So, like I said, we're talking about two advanced stages of both Parkinson and COVID-19. And obviously, if this is a chronic thing, so if you do have a problem in your thoracic muscles and you're limited in expanding your chest, you are unfortunately a candidate for intubation, because you can compensate with an increased volume of air per breath. So you can't bring more oxygen in. So you're going to have an oxygen mask, but if that doesn't work, they just need to intubate you to put you on a vent, because your respiratory system is not enough. It cannot fit the request of your body of oxygen in order to take care of all the metabolic requests.
Right. So I just have one comment and one question, and then I'll open it up for some questions if you don't mind. Mm-hmm. My comment is that my wife is a nurse, a registered nurse, and she retired from her full-time job last year, but she still does a couple mornings per week home care. And even without COVID, one of the things that I find interesting and rather disturbing and sad more than anything is that when somebody falls down, for example, maybe they break a hip and it takes a long time to recover, and they move, like everything you just talked about with reduced movement and this and that. Then we get into, if they're in bed too long, bed sores, mm-hmm. Surgery because of bed sores, especially if they're not in a place where they're getting turned enough or they can't turn themselves. And the potential, depending upon the situation, is actually quite big for all kinds of things to go wrong, just from, well, I'll just say a fall that led to a hospital visit that led to pneumonia, or getting COVID and needing to be in bed. And it can get super complicated, right?
Absolutely, yes. And when I was in med school, there was a way to identify a patient, over 70, over 75. It was the fragile patient. Mm-hmm. And not just fragile because the bones might be brittle, yes, you have an increased chance of having osteopenia or osteoporosis. You have an increased chance of having chronic respiratory problems. But the thing is that the fragile patient is the one that is more prone to have complication from regular injuries. So is more prone to have a limited response to drugs or side effects, because the whole metabolism doesn't work in the efficient way that you expect in a healthy individual that is between 20 or 40 or 50. So obviously, you have to recalibrate your approach for the management and the treatment of the patient when it's past a certain age. You have to factor all the conditions in. So you have to consider, is this patient digestion normal? Is the patient, cardiovascular system normal? And normal, depends, because of course you may consider normal certain parameters of blood pressure for a person that is 30 years old, and different parameters for a person that is 75 years old.
Right.
So obviously, you don't want to have an individual 75, suffers for high blood pressure. You don't want it to bring it down to 120 and 80. Because
sure.
If his body has been exposed to a certain levels of blood pressure, let's say 145, 160, you don't want to drop it to 120. So the goal for your treatment must be calibrated to the person.
Exactly. And sometimes I don't always finish my my train of thought, and the only reason I mentioned my wife is she's the one who many times going into these households after someone gets out of the hospital, and she's treating the bed sores, having to change the dressings on them and things like that. So it's, I hear stories, and it's interesting. So I have only one question real quick, and then we'll do a few question and answer. I already know your answer to this because we've talked about this a few times, but to protect yourself against COVID, what do you recommend? And I'm asking you because I trust you implicitly. Whatever you say is what I'll do.
Well, here's the thing. There are several strategies, and many countries have adopted slightly different strategies, and these different strategies have given different outcomes. depending on the countries, depending on the compliance of the citizens in these countries. COVID is a pandemic, so it really brings us to the field of community genetics. It's not just about you have what is called a noxa, so a pathogen, and you look for the cure and you treat the individual. No, the management is a community management, is a community strategy. So you really need to tackle this problem as a group. And everybody plays a critical role, because if you have one person or one group of people that inside your community doesn't stick to the rules, you have complications that will expand to the whole community. As community medicine, the first initiative, of course, comes from the above, from the government. So you take certain guidelines and you try to advise the population, you try to give some suggestions about things to do. And eventually, if necessary, you take certain drastic initiatives like the lockdown. Of course, the lockdown is pretty traumatic in terms of limiting the individual freedom to act, to work, to do, whatever people want to do. And it has a heavy toll on the economy. But the concept behind the lockdown is really to allow the government, so that the healthcare system, to provide decent service to the largest part of the population possible. So why the lockdown? Is not the lockdown to eliminate COVID-19. That would be ideal. But the main goal of the lockdown is to prevent the overload of the ICU and the hospitals, and therefore allowing the hospitals to still try to provide, healthcare to the population. The lockdown was tried, and unfortunately, it did work in some countries to take down the numbers and keep them now under control, but it did not work in other countries like the United States. We know that the numbers are still high.
I'm interrupting for 1 second, though, and I'm not a politician, and I'm not intending to talk about that whatsoever. But
No, me neither.
No, and I know you're not either, because we've talked about this before, but we actually never did an actual lockdown in this country.
Yes.
Versus Italy, where you had to have a pass and a negative COVID test or something to even get out your door and go down the road. There's a big difference, which is probably why Italy had a greater success rate than we have, because we never locked down.
Yes, that is true. There was never a monitoring system that was ensuring that every citizen was complying to the lockdown rules. Mm-hmm. Which is understandable. You have different cultural backgrounds and different interactions between the government and the individual citizens.
Sure.
Then again, that goes into the politics field, which I don't even dare to.
Me neither.
So,
but when I see people posting that we already locked down and it didn't work in this country, they may not understand the concept of an actual full lockdown, which didn't occur. And that, we could go back and hash over that, and it's, in a way, it's irrelevant, but it's also good to know that we actually didn't do it. But also move forward in what's the next best way of protecting ourselves and each other.
Unfortunately, even countries that did do it, like Italy, they basically spoiled, all the benefits of lockdown once the lockdown was lifted, because in the summer, there has been an increase now of cases.
Yeah.
People were not compliant to the guidelines, and this is the second part of my answer. So if coercion or coercive initiatives imposed from above don't work, then it is down to the individual citizens to be responsible for themselves and for the others in the community. Mm-hmm. And the reason is simple. It's not just about avoiding that you get COVID. It's not protection of yourself, but is limiting the possibility that the virus goes around.
Sure.
right now, luckily, for a series of reasons, people have developed some level of immunity. There are strategies as a treatment or prevention. The warm weather, might have limited the onset of comorbidities. I'm not talking about COVID. I'm talking about comorbidities. It would be,
Sure.
flu and other things that might get the clinical presentation worse. For a series of reasons, the high number of cases we are now witnessing, especially in the state south of the United States, because we're now seeing, in terms of prevalence, so in terms of people getting infected in the states of the south, is comparable to what we were observing in March and April in the states of Northeast, so New York, Massachusetts, and so on. But the difference is the mortality. Way more people were dying 4 months ago, 5 months ago, in those states, Northeast, that we're getting the same number of people infected than we're now recording in the states of the South. So why the mortality has decreased? We don't have a definitive answer yet, but there are, like I said, many components,
Sure.
So the real problem is that even if we don't have that high mortality, even if we don't have that high number of people filling up the ICU, we still have a problem with the virus being around so much. And so more people are getting infected, even if they are asymptomatic or they're showing few symptoms. And that means that potentially they can carry the virus and spread the virus to other people. And then when the cold weather will be back, when other factors will be back that played a big role in the high mortality that we observed in March and April, then we're going to have more people that have the COVID virus and may actually develop that severe symptoms. So what will look like a second wave, it will be a second wave in terms of severe complications, but it will still be the same first wave of virus because
Yeah.
they never went away.
Right. Okay. Interesting. Well, I'll tell you what, at this point, I just want to, I'll change the screen a little bit and let's go into, wait a second, I'm sorry, 1 second. All so fascinating. So does anybody have any questions? This would be a good time to ask. Any questions for Dr. Luigi Bocutto? And if you do, just unmute yourself and speak up. Because he and I have talked a few times. My questions are answered.
I've got a couple questions.
Sure, Amy.
Dr. Bocutto, do you subscribe to the use of vitamin D, zinc, and vitamin C, for the, immunity bolstering effects against COVID or against other things in general?
Yeah, I think the second part is the most effective one, against other things in general. So it hasn't been proved a direct role on COVID, but the thing that still is valid and supports the use of these supplements is that it will strengthen your immune system. So we were just talking, a few minutes ago about the importance of comorbidities. So if you can avoid to get the flu this winter, definitely will be a good thing, both because you won't get the flu and both because if you get a double infection of the flu virus and the SARS-CoV-2 virus, it definitely you'll have more severe symptoms. So now more than ever, it's important to take good care of your immune system, but also of your body. We were talking about, managing your body weight and preventing the onset of diabetes, because all those things will actually open the door to a more severe COVID presentation.
Good question, Amy. Thank you.
Mm-hmm.
Did you have another one?
Not right now, no.
Okay. Anybody else? So let me just ask you this then, Dr. Bocutto. Wearing a mask is a good idea when you're out in public would you say?
Absolutely. Yes.
Yes. I mean, I don't like wearing it, but I wear it because I have my own issues, and I can't help thinking maybe the mask protects me a little bit, but just in case I'm a carrier, even though I test negative every week, because I have to go every week for testing because of a couple of senior centers I work in with people. I don't know if I was a carrier, if it would come up positive test or not, but bottom line is I don't want to transfer this to anybody. So I never have liked suntan lotion or hand sanitizer or any kind of cream on my body, but I'm Mr. Hand Sanitizer now. I'm Mr. Mask Wearer because I have a granddaughter coming into the world next month too, and I want to make sure I'm healthy, you know, and not trans something that my daughter or her too. So a mask is a good idea.
Yeah. So let me say three things. First of all, I would like to say you're welcome to Rasta thanking me. That's a pleasure. Second, I would like to go straight to the mask and say why is a good idea. Because right now we don't have anything else. I know it sounds very weak as an argument, but it goes straight to the point. So there are trials now on remdesivir, which is an antiviral, treatment.
Mm-hmm.
There are, I think, 7 or 8 trials for a COVID-19 vaccine that have entered the phase 3,
Mm-hmm.
being tested on a large population of volunteers. So, science is advancing, but science is science. So it's not perfect. It's fallible. And we heard everybody the fact that a few days ago the experimentation of phase 3 of the Moderna vaccine has been put on hold because one case with severe side effects.
Mm-hmm. Yeah.
Out of like 50,000 people that right now have been tested, one case is not obviously, if you look at numbers, doesn't seem too concerning, but it was a quite severe thing, so they just need some investigation. Now, that said, what we have right now is social distancing, masks, washing hands, just trying to take care of that. So it has been proved that it does affect the likelihood of transmitting the virus. So the second point, like I was saying, simply is just like you want an answer, you want some strategy from science, and science is telling you wear a mask. Then the third point, which might seem almost silly, is why not? Like, why not wearing a mask? Many people are presenting the argument that says, well, it's not really going to save your life. Well, it's uncomfortable, and people didn't produce ultimate evidence that it will stop COVID. And I understand, that if you go and dig deep enough, you might find some conflictual studies or things like that. But the thing is that if you put everything in perspective, wearing a mask can save you from being intubated and attached to a ventilator, or could save you from spreading the virus to your grandparents or your parents or your beloved ones, like you said, your granddaughter. I mean, so really my answer is why not? I know, again, it doesn't sound like a very sound scientific argument, but like I said, this is an issue of community medicine. And when it comes to community medicine, you really need to focus on the greater good. And people that bring us, contest the use of a mask because they said is uncomfortable, or it bothers me to wait for like 2-3 hours when I'm out there. They need to understand what is the impact of the mask on their lifestyle versus what is the impact of COVID on everybody's lifestyle. This is an emergency. Yeah. It shut down the world. Mm-hmm. So we really need to look beyond ourselves and the fact that, wearing a mask might leave a sign on your skin or might be uncomfortable. It might make, a little bit your glasses foggy and things like that. Because the impact that this virus has, even on healthy people, like a few days ago, I was reading, and sorry if I keep citing Italy.
Oh, it's good.
Since I'm Italian, I keep an eye, on what is happening over there.
I love Italy.
But thank you. But this is just to give an idea, and I can cite other countries. But the thing is, a few days ago, they reported that the average age of individual testing positive to COVID in Italy is now 28 years.
Whoa.
So COVID is no longer a condition that affects, the elders. It's no longer a condition that affects only people that have emphysema and they're like in their 70s or 80s. COVID, in terms of infection, affects everybody except probably very, very young children. The clinical manifestations might present different shades according to the presence of hypertension, obesity, and diabetes, or the presence of COPD, or the presence of other progressed, disorders. But the risk of being infected by COVID touches every single one of us. So really, I know it sounds silly to just answer with why not, but to me it sounds even sillier to say that people refuse to wear a mask because it makes them feel uncomfortable.
Thank you for that. Yeah, Laura, I just looked it up on my translator, but if you don't mind, would you translate that? So, Luigi, we have a question or a comment from
Okay.
Her name on here shows Sofia, but her actual name is Angeles. Hola, Angeles.
Hola. Sí, claro.
Bien,
claro.
bien.
Puedo hablar español, sí.
Oh, perfecto.
No es perfecto, pero.
Okay. Well, go ahead.
Okay. I'm gonna translate for Angeles. She wants to know that why Parkinson's symptoms get a little bit worse during the quarantine.
So I don't have evidence like scientific works that looked into that. What I can think of is that the forced inactivity, that the sedentary lifestyle, like we were saying at the beginning, has really impacted, the quality of life of these people. So we were talking, you were mentioning, at the beginning of this call, the rigidity. That is a critical factor. So if a person that was accustomed to go out and walk for a mile every day, or every other day, or just simply take a walk out, well, if that person is now forced into an apartment and cannot, perform certain exercises, obviously the rigidity gets worse. I'm
interrupting 1 second. Just 1 second. I'm sorry. Laura, do you want to share that with?
Yes.
Yeah. Well, so
yes.
Let's share that first part and then continue, Luigi.
Thank you, doctor. I'm going to translate for Dr. Luigi. Ángeles y todos aquí presentes, el doctor dice que probablemente se deba al aislamiento, a que el ejercicio que estamos haciendo en casa o en el departamento donde vivimos, pues no es lo mismo que estés acostumbrado a caminar 1 kilómetro o varias millas en el exterior, entonces que probablemente por ese motivo tengas más rigidez, cosa que me pasa a mí también, doctor. Yo también tengo Parkinson. I don't know if you understand my Spanish, doctor. Okay.
Sí, claro. Y puro la situación que no tengo evidencia científica, porque no conozco artículos de la literatura científica que digan que los síntomas van más malo por la cuarentena. Eso yo no sé.
Okay.
Es siempre importante de controlar las fuentes de las informaciones.
Uh-huh.
Lo que pasa es que en México, mis compañeros de Parkinson hemos notado ese avance tan más rápido de los síntomas. Hemos estado preguntando y comentando.
Okay, you need help on that, doctor?
Yeah, there is like a sound I couldn't on the background.
Okay, she's asking that here in Mexico, her other person she knows with diagnosed with Parkinson's have this common denominator that they have their symptoms has worsened than they were. I mean, they're not good anymore. I mean, They were better, and now they're just one step or two steps back.
Okay.
She wants to know, why.
Yeah, I'm going to answer this in English so that, it's for everybody. And then if you will be kind enough to translate. It is important to report the situations. But like I said before, it's very, very important to look at the sources. So if there are scientific studies that looked at a cohort, a group of people that present those things, and there is a significant trend, then there is something that must be shared in the Parkinson's community. The reason why I'm saying this is that otherwise there is a risk to give in to anecdotal evidence. So the evidence of just an individual case or an individual group of cases. This is not me saying that I don't believe that, or I don't believe that is a real trend. But in order to try to take countermeasures, we need to study this trend. We need to study this phenomenon and make sure that is actually something that applies to either all the individuals with Parkinson during quarantine or a large group of individuals with Parkinson in quarantine, and how it manifests, how it shows.
Ok, Ángeles, te voy a ayudar a traducir. Dice que tienes que ver casos, tienen que primero referenciarse a un artículo científico, que tiene que hacer una investigación al respecto si se trata de una persona, de dos personas, de un grupo de personas o de una comunidad ya más grande de personas con Parkinson, pero que pues tendrían que hacer una investigación al respecto que en este cuarentena y pues no es fácil, digamos, que pudiera ser por el aislamiento, pero tiene que referirse a más estudios, a más investigación. ¿Está bien dicho, doctor?
Sí, claro. Again, it's not like I don't believe. No es que no creo. Yo soy seguro que es verdad. Es importante por la estrategia de tratamiento, de comprender cómo eso se hace, cómo how the phenomenon manifests itself.
¿Cómo se manifiesta el fenómeno? Depende ya cómo se manifieste cada caso.
Interesting. Wow. It's all so complicated. None of us have been alive long enough to have this, to have gone through a pandemic previous to this. So this is a first for all of us. And, I think I get a lot of information from my son, and as he's in the emergency room at Emory in Atlanta and sees COVID on a regular basis. But it's like, it's hard to have solid answers right now for something that's so new, even though it's been around longer than some people think. And you and I talked about that previously, Luigi, but
yeah,
bottom line is that the jury's out. We're discovering more and more things, and I'm not a doctor, but I've heard a lot about it, and it seems like there's a lot to learn still as things unfold.
Yes, and you mentioned previous pandemics, like the Spanish flu.
Mm-hmm.
The thing is that people have been accustomed to have such a great healthcare that really, they miss the perspective. So if you put things in the right perspective and you think about that impact that the Spanish flu had, even if it didn't have that fast spreading, phenomenon that we observed with COVID, but it killed millions.
Mm-hmm.
Now, of course, I'm not saying that people need to accept the idea of millions of deaths. Unfortunately, all around the world, we're now about to approach the 1 million cases, of deceased individuals. But the point is, people expect too much, or some they have unrealistic expectations in terms of the science timeline at providing effective cures, finding effective vaccines in a relatively short time, extremely short time. The average time to develop a vaccine for a pathogen may go up to 10 years. And as
Right.
I mean, we don't have a vaccine for the common cold, and it's been around for centuries, for millennia.
Yeah, right.
So it's not like, oh, there is a new virus, let's have a vaccine by a month. It doesn't work like that. At the same time, people might have lost the perception of sacrifice in terms of countermeasures. The idea of having so many people in the hospitals, so many people, unfortunately, that passed away because of COVID, it's really dramatic. And still we have people that are complaining about wearing masks because they don't realize the impact on a community level that being or not wearing a mask could have.
My comment to that is two things. I agree wholeheartedly. And my next comment is, sorry folks if I offend anybody, but don't let your personal rights get in the way of your personal responsibility to your community, because we need to help each other. I mean, that's what I'm here for, is to help people. And knowing this information, I've had the pleasure to talk with Dr. Bocutto many times, but I went into this early on realizing the depth, potential. I knew it wasn't the normal flu. It's not a common cold, and it's traveling so quickly because, in 1918, there was no international air travel. People weren't going to the airport and jumping on planes. Well, now they are. So this hit, and it hit really fast. And so that also didn't help with the ICUs being filled and hospital beds shortage and all that. So I really appreciate, Luigi, how you have eloquently state things, and also, the depth of your knowledge, but also just bringing to light the importance of this is a community effort, not just, it's a community effort.
Yeah.
So,
and if I might add, you said that very eloquently, the distinction between rights and responsibilities, but we need to consider that our rights, our individual rights, are based on the premise of a free society, with free civilization. And that comes with cost. We are not free to do whatever we want. We are free to act according to certain social, guidelines, social conventions. But those social conventions do dictate to follow some guidelines. And in terms of emergencies, that there might be emergency guidelines. So we need to follow those as well, because we are part of the community. And, the example that when we talked before, I think it's always, a good example to reiterate. You can't say, I'm not going to pay for asphalting, putting asphalt on 200 yards of the interstate. I don't want my taxes, to go there. You can't, just say, okay, I withdraw my taxes for those 200 yards. You don't put the asphalt there. No, because it's something that goes to the whole community. You can say, pull out one soldier from the army. I'm not going to pay for that one soldier. I will take care of that. No, it's part of being part of a community. And following certain rules is part of that as well.
That, that perspective, that actually changed when we talked about it before, how I see certain things too. I would ask if there are any other questions, except that in the interest of time. This is a good one from Laura. Is there any medicine used for COVID that we shouldn't use as a person with PD? That's a good question. We're going to take that one.
Honestly, don't know. I have to be honest, because we don't know yet about impact of Parkinson's drugs on COVID, and we don't know about the impact of COVID drugs on Parkinson. Like I said, there is that nice paper from our friend Alfonso Fasano and others that show that in the presence of advanced Parkinson symptoms like dementia, you have an increased risk for COVID complications. And so that the complications also include, unfortunately, high risk of mortality. But once again, you know, we have among those Parkinson's symptoms hypertension. So it's still a circle. So if you have anything that will increase the expression of AC2 receptors, not strictly related to Parkinson, I know this goes beyond the question, but you know, try to work more on your life hygiene. Try to work more on keeping yourself healthy, keeping your body weight under check, and do yourself a favor, you know, and be careful when you go out, wear a mask, wash your hands. I think these are still the best things right now, the best recommendation.
That makes sense. Thank you. Well, I appreciate so much you
Pleasure.
joining us, Dr. Luigi Bocutto. You're always so generous with your time, with your information, and your knowledge and wisdom. I tell you, I learned a lot. Thank you. Thank you, sir. And you're welcome to hang out with us. If you want to hang out, you can. I know you're busy, but just saying, if you want to hang, you can. Okay.
I would love to, but I have another call in 10 minutes, so I didn't need to get ready.
Hey, no problem. Well, thank you so much, my friend.
Yeah.
All right, we'll be in touch soon.
Bye.
All right.
Bye.
Thank you.
Thank you.
Well, that was insightful. Wow. Yeah, I didn't expect all that. I knew he'd had some great info, but I don't know about for you. I really learned a lot there, not just about Parkinson's and COVID, but it really makes sense the way he ties things together there. He's such a nice gentleman too. So, as I said, we're not taking any breaks.